Hello, welcome back. In this video, we're going to be seeing sample questions that you might come across in your certification exam. Now, I've made a Kahoot where you could try these questions out maybe before watching the video so that you can kind of give yourself an idea of how good or how bad you're doing. After you finish the Kahoot, you can come back and then watch the explanations. If you could, please share it, and so that more people can be exposed to these questions, and hopefully everybody's just better prepared for the examination. And for those that do not want to do the Kahoot or are not familiar with the Kahoot, what I would recommend, take out a piece of paper, and you're going to see that you're going to have 10 seconds between the question and the answer, so that you could write it down, think about it, write it down, and then see if you're right or you're wrong. And well, let's get started. All right, so here's the first question. Which of the following types of artifacts is an EKG? A, wandering baseline. B, AC interference. C, broken recording. D, somatic tremor. You're going to have 10 seconds. Hopefully now you know the answer. And so for this one, the answer is a wandering baseline. Remember that the isoelectric line, or the baseline, is supposed to be perpendicular to the bottom of the paper. In this case, we can see that it wanders. We don't want that, and that is why it's called a wandering baseline. The most common reasons for this is usually patient breathing, patient movement. Sometimes if the electrodes are coming a little off, you might also see a wandering baseline. But those are usually the most common reasons for a wandering baseline. Now, an AC interference is this one up here. This is when we see this sort of machine-like movement, very rhythmic, quick movement. That's AC interference. Somatic tremor is this kind of random interference that we see on the baseline. Remember, the baseline is supposed to be nice and flat. And then the last one, this is a broken recording. We can see that it is normal here, and then all of a sudden it becomes crazy. And this one is usually because the electrodes come off. Next question. An MA is about to do an EKG. What is the ratio of applied leads to recorded leads? A, 10 to 10, B, 6 to 6, C, 10 to 12, 8 to 12. I'm going to give you 10 seconds. Okay, so for this question, it can be a little confusing because it's using both leads as the terminology for electrodes and then leads as whatever's actually recorded on the paper. Some people use it interchangeably. That's okay. So anyway, how many electrodes do we apply? We apply 10 electrodes. We have 4 here, and then we apply the 6 precordial, right? So we apply 4 limb leads and then 6 precordial. But that gives us 12 channels. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So even though we apply 10 electrodes, or 10 leads in this case, we actually obtain 12 leads. And that's what this one's asking. Number 3, what is the patient's heart rate? A, 58 beats per minute. B, 120 beats per minute. C, 68 beats per minute. D, 82 beats per minute. 10 seconds. All right, and the answer for this one is C. So how do we figure this out? Well, there's several ways, right? We can use the 1500 rule. And what do we need to know? What do we need to count for the 1500 rule? Well, we need to count the little squares. So let's count them. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. So we have 22 little squares. If we do the math, it is 68.18 beats per minute, which we could just say it's 68 beats per minute. Now we want to use the 300 rule. We're going to count the big boxes. So we have 1, 2, 3, 4, and then we have 2 left over. So we're going to divide it by 4.2? No. We are going to divide it by 4.4. Now, if you don't remember this is a percentage. So if you need to review why, then just go back and rewatch that lecture. And 300 divided by 4.4 is 68.18. Now, I'm not going to go over the 6-second rule on this one, but I will in another question. All right, so number 4, an MA asks another MA, hey, which lead will give me a better rhythm strip? What should the MA answer? I'm going to give you 10 seconds. And the answer for this one is B, lead 2. Now, what is the rhythm strip? So you're going to see that on the EKGs, the top part, right, where it gives you all the 12 leads right here, it only gives you a few seconds worth of rhythm, right, which is fine, but you will usually see on the very bottom of the EKG a big strip, and we call this the rhythm strip, and it's almost always lead 2. Right? And this gives the doctor just a better understanding of the actual rhythm of the heart, as opposed to just these little snippets that we can see up here. And it's almost always lead 2. All right, number 5. Which of the following represents ventricular depolarization? 10 seconds. Right, and in this case, the answer is B, ventricular depolarization. And depolarization is the same as contraction, right? And where do we see that contraction? That systole, well, that's going to be on the big QRS complex, which in this case is letter B. Next one, what is the standard speed of an EKG recording? 10 seconds. In this case, the standard speed is 25 millimeters per second, right? And actually, so I have a picture here of an EKG, and you can see that almost always on the bottom of the paper, you're going to see the speed, which is 25 millimeters per second. And so what does that mean? That means that these tiny squares, actually the squares inside the squares, kind of hard to see in this image, should print 25 of those per second. Now, if this question was a little different, what if it was asking, what is the gain? What is the amplitude of it? Well, the amplitude is this. And it should be, again, it tells you down here, that one should be 10 millimeters per 1 millivolt. So make sure you know 25 millimeters per second for speed. And make sure you also know 10 millimeters per millivolt for voltage. Gain, again, these areas right here, or the amplitude. What artifact do you see on the tracing below? A, somatic tremor, B, wandering baseline, C, premature ventricular contractions, D, electrical interference. 10 seconds. All right, so the answer for this one should be D, electrical interference. And again, we see that the baseline is not nice and even. We have these very machine-like spikes, very rhythmic. That is electrical interference. The most common reason you're going to get those is because the patient is either is wearing something that is plugged to the electricity, or they're wearing a cell phone or a smartwatch. Something is causing that electrical interference. A somatic tremor, which is the one that has this random variation of the baseline. I want you to notice the difference though between the electrical one and the somatic one. Electrical one is machine-like, somatic is pretty random. The wandering baseline is this one where the isoelectric line is just, again, wandering. This one is usually caused because the patient is breathing, patient's moving. Sometimes even if the electrodes come a little off, you might even see that. The premature ventricular contraction, this is more of an arrhythmia, and this is when the ventricles contract randomly. You see normal heartbeats, and then out of nowhere you see this random ventricular contraction, and that's a PVC. Next question. An MA is looking at an EKG. She notices there are normal cardiac cycles with a sudden white QRS complex that is not preceded by a P wave. What is the MA looking at? A, sinus arrest, B, sinus bradycardia, C, premature ventricular contraction, D, normal sinus rhythm. I'll give you 10 seconds. The answer for this one is a premature ventricular contraction. We actually just talked about this one. And again, we can see normal contractions, and then out of nowhere, you see this huge QRS complex that does not have a P wave. This is not a P wave, that is a T. So it is not preceded by a P wave, it's just a random contraction of the ventricle. A sinus arrest is when the heart stops, but in this case it just skips a beat. Sinus bradycardia is when the heart rate is slow. Remember that the heart rate should be 60 to 100 beats per minute. So anything below 60 would be sinus brady. And then normal sinus rhythm would be a heart rate that is between 60 and 100, as we just talked about. Which of the following represents the ST segment? A, B, C, or D? 10 seconds. All right, and in this case, ST segment, that is not a contraction, that's just a section of the EKG, and that is D over here, which is this area right here. And remember, this is important for heart attacks, which a medical term for a heart attack is an MI, a myocardial infarction. On an EKG, we see a heart attack as a STEMI, right, which is a ST elevation myocardial infarction. And you may notice an EKG shows a rhythm of 120 beats per minute. What type of rhythm is this? A, atrial fibrillation, B, sinus bradycardia, C, sinus tachycardia, D, normal sinus rhythm. 10 seconds. All right, so remember the heart rate should be 60 to 100, right? So anything above 100 is tachycardia. So in this case, the answer is sinus tachycardia, C. A flutter is when the atria, right, the chambers on top, are contracting much faster than the chambers on the bottom, the ventricles. And we can see that here. You see contraction, 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 contraction of the atria, and then one contraction of the ventricle. Contraction, 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 contraction of the atria, and then one contraction of the ventricle. It shouldn't be that way, right? It should be one contraction of the atria, one contraction of the ventricle. Sinus bradycardia, now this one is just anything below 60, right? Because the normal heart rate is 60 to 100 beats per minute. And then normal sinus rhythm, well, this would be a heart rate that is 60 to 100. Number 11. Which of the following is an acceptable instruction for a patient wearing a Holter monitor? A, it's okay to shower with the monitor on. B, if an electrode becomes loose, put some tape on it. C, do not drive. D, start your diary 3 days after you finish wearing the monitor. 10 seconds. Right, and so for this one, remember, Holter monitor is a machine the patient's going to be wearing usually for about 24 hours to kind of detect the arrhythmias. Usually when they feel something in their chest, they'll press a button, and they usually keep a diary as they're wearing their Holter. They're not supposed to shower with it. They can drive with it, but they are supposed to keep a diary as soon as they start wearing the monitor. And so really the only good instruction here is if the electrodes become loose, put tape on it to put it back. So the answer is B. Number 12, which of the following represents ventricular repolarization? A, B, C, or D? 10 seconds. So the answer for this one, ventricular repolarization, should be C. Remember, repolarization is the same as relaxation or diastole, right? Now this is not 100% true, but for the purposes of this exam, we are considering them to be the same thing. And so the T wave is ventricular repolarization, ventricular relaxation, or ventricular diastole. Number 13, which of the following is true? A, V6 through V12 are limb leads. B, the right arm serves as a ground. C, AVR is a bipolar lead. D, limb leads should be placed in fleshy areas. 10 seconds. The answer for this one is limb leads should be placed in fleshy areas. All right, so let's talk about each one of these. This should actually be V1 through V6. Right? And these are not limb leads, these would be precordial leads, right? The right arm serves as a ground. No, it is not the right arm. It is the right leg. Remember, the right leg serves as a ground. That is really important. AVR is bipolar. No, AVR is monopolar or unipolar. You might hear it either way. Limb leads should be placed in fleshy areas. Yes, remember the limb leads, that is your right arm, left arm, right leg, left leg. You want to place those over sort of a You want to place those over meaty areas, not bony prominences. Next one, which of the following represents atrial depolarization? A, B, C, or D? 10 seconds. All right, so atrial depolarization would be atrial contraction, right? Or atrial systole, and that is A, the P wave. The P wave is atrial depolarization, atrial contraction, atrial systole. Next one, where does the electrical impulse start in the heart? A, atrioventricular node. B, sinoatrial node. C, bundle of His. D, Purkinje fibers. 10 seconds. Right, and so the answer in this one is the sinoatrial node, the SA node. Now remember, the electrical activity of the heart, it's always going to start in the SA node, the sinoatrial node, right? The SA node is going to send a signal down to the AV node, which is this one, right? And then from there, we're going to have the bundle of His, the left and right bundle branches, and then the Purkinje fibers. You don't really need to know the bundle of His, the left and right bundle branches, the Purkinje fibers. Just make sure you know the SA node and the AV node, and make sure you know that both of them are located on the right atrium. Next question. An MA is placing an EKG. Where should he place a V5? In the fifth intercostal space, left midclavicular line. B, in the fourth intercostal space, right parasternal line. C, in the fifth intercostal space, left anterior axillary line. D, in the fifth intercostal space, left mid-axillary line. 10 seconds. All right, and so the answer here is C, in the fifth intercostal space, left anterior axillary line, which is this one right here. Remember, the axilla is going to have 3 lines, an anterior axillary, a middle axillary, and then a posterior axillary. And it is in the fifth intercostal space, left anterior axillary line. All right, 17. Which of the following is not true? A, AC interference is not caused by cell phones. B, a wandering baseline can be caused by a patient's breathing. C, somatic tremors due to a patient's breathing. D, interference can be fixed. 10 seconds. And the answer is A, AC interference is not caused by cell phones. Well, AC interference can be caused by cell phones, so that is not true. A wandering baseline can be caused by a patient's breathing, yes. Somatic tremor can be caused by patient's breathing, yes. Interference can be fixed, yes. So the correct answer here would be A. 18. In a 6-second strip, there are 4 cardiac cycles that involve the P wave, QRS complex, and T wave. What is the cardiac rhythm? A, atrial flutter. B, sinus bradycardia. C, ventricular fibrillation. D, sinus tachycardia. 10 seconds. All right, and the answer is sinus brady. Now, why? All right, so let's talk about this one. So in a 6-second strip, we said that you needed 5 big squares. We said you needed 5 big squares for 1 second, right? So in 15, which is from here to here, that is 15 big squares. This is 3 seconds. So then this is another 15 big squares, so this is another 3 seconds. So on this whole thing, it is 6 seconds. Okay, now we're going to count cardiac cycles, and a cardiac cycle is composed of a P, a QRS, and a T. So this is 1 cardiac cycle. 1, 2, 3, 4, and then just go with 5. So we have 5 cardiac cycles, so we're going to multiply that times 10, which equals 50. Now why times 10? Because in 1 minute, you have 60 seconds. And here, we have 6 seconds. So we multiply 6 times 10, we get 60 seconds, which is the equivalent of 1 minute. So 5 times 10 equals 50. 50 beats per minute. And that is the heart rate, right? And normal heart rhythm should be between 60 and 100 beats per minute. So since this one is below 60, it is sinus brady. A flutter is when the atria contract more than they should. VFib is this kind of random quivering of the ventricles. This will kill you fairly quickly. And then sinus tach is any rhythm above 100 beats per minute. Next question. An MA is placing an EKG. Where should she place a V2? A, in the fourth intercostal space, right parasternal line. B, in the fourth intercostal space, left parasternal line. C, between V1 and V2. D, in the fourth intercostal space, mid-axillary line. 10 seconds. And the answer is B, in the fourth intercostal space, left parasternal line. Remember, this is the sternum, and there are these imaginary lines that run next to the sternum. We call these parasternal lines, para meaning next to, right? The spaces in between the ribs are the intercostal spaces, and both V1 and V2 are going to go on the fourth intercostal space. The difference is V1 goes on the right intercostal space and V2 goes on the left intercostal space. So V2 goes in the fourth intercostal space, left parasternal line. V1, on the other hand, goes on the right parasternal line. Between V1 and V2, well, there is nothing. And in the fourth intercostal space, mid-axillary line, there is V4. Number 20, an MA is placing an EKG on a patient with dyspnea. In what position should he place the patient? A, semifowlers, B, prone, C, lithotomy, D, supine. 10 seconds. And the patient should be placed in a semifowlers. Remember, dyspnea means shortness of breath. So a patient who's short of breath, you don't want to place them completely flat, which is supine. You don't want to do this. That's a supine position. You want to place them in the semifowlers, which is this one. A prone position is basically face down, laying flat. And a lithotomy is this position, which is more of a gynae position to explore that area. 21. An MA notices very rhythmic, sharp spikes on an EKG. What is she looking at? A, somatic tremor. B, interrupted baseline. C, AC interference. D, this is normal. 10 seconds. All right, so I'm hoping that by now you really are getting these artifacts. In this case, these rhythmic sharp spikes. This is what we're referring to, and this is electrical interference, also known as AC interference. The somatic tremor is that random tremor, usually caused by movement. The interrupted baseline is this one, which is usually when an electrode comes off, and then the wandering baseline is this one, which is usually caused by some sort of breathing, sometimes movement. Next one, which of the following is a proper instruction for the patient prior to having an EKG test? A, do not smoke for at least 3 days prior to the test. B, take all your medications on the day of the test. C, do not eat for at least 6 hours prior to the test. D, do not shower for at least 4 hours after the test. 10 seconds. And the answer here is take all your medications on the day of the test. The patient can smoke, the patient can eat, and obviously they're going to shower. So here really the only one that makes sense is B. Number 23, which of the following is a bipolar lead? A, V2, B, AVR, C, lead 3, D, none of these. 10 seconds. And the answer for this one should be lead 3. So remember, Einthoven's triangle, right? Einthoven's triangle is going to be composed of lead 1, lead 2, and lead 3. And those are all bipolar because they're using 2 poles to make 1 lead. You use 2 poles to make 1 lead. That's why those are called bipolar. V2, V1 through V6, these are your precordial. These are your precordial leads. And then AVR, AVF, and AVL, right? These are monopolar because they're only using 1 pole. It is different. They are different from the limb leads. 24. An MA is placing an EKG. Which electrode should be placed on the 5th intercostal space mid-clavicular line? V2, V4, V5, or V6? 10 seconds. And the answer is B, V4, right? So, we said that this is the clavicle, right? In between the ribs, you have the intercostal spaces. So that's 1, 2, 3, 4, 5. And on the middle of the clavicle, in the 5th intercostal space, that's where you're going to have V4. If you want to use a landmark on a thin male, it would be pretty much underneath the nipple. So we've hit a lot of these electrode placements pretty hard. I hope they're starting to stick. Make sure you go over these over and over again. You're really only going to need them for the test, but make sure you know them. 25. An MA should blank the ECG before each patient. A, disinfect. B, sterilize. C, turn on and off. D, change the machine. 10 seconds. The answer for this one should be disinfect. And disinfecting is when you use alcohol, Clorox, some sort of chemical to wipe down the machine. You're obviously not going to use soap and water because 1, it's not enough, and 2, you might damage the machine. Sterilizing, well, you're not going to sterilize the machine because then, the whole sterilizing process is pretty complicated and you can damage the machine as well. You would not turn it on and off, and you would not change machines unless there's something defective with the machine, but you should disinfect, wipe down the machine between each patient. All right, and that's pretty much it for the questions. Now, if you were writing this down, hopefully you kept along. This is what you would get. Let's aim for above an 80. So if you got 0 wrong, you get 100, 1 wrong, 96, 2, 92, 3, 88, 4, 84, 5, 86, 76. Hopefully y'all did good. If you need to review, well, you can watch this video again, or you can go back to the lecture, review the lecture. If you see any errors, make sure you leave a comment. I would also really appreciate if you like this video and subscribe, and just stay tuned for more videos. And thanks for sticking around. Happy studying.